Hello, in this video we are going to talk about cyanosis. So let's start with the introduction. The word cyanosis comes from the word cyan, which is a bluish green color. Now cyanosis is a condition when your skin, lips, nails or any other body part turns into a bluish purple discoloration. Now by definition we can say that cyanosis is a bluish discoloration of skin and mucous membrane due to reduced oxygenated hemoglobin more than 5 mg% in blood. This basically means that when our hemoglobin decreases below 5 mg% in blood, it will lead to cyanosis. Next, we will talk about the reason behind the bluish purple discoloration in cyanosis. Now, as we know that RBCs in the blood carry oxygen to different parts of the body. Now, when blood is filled with oxygen, that is blood is oxygenated, it appears as bright red in color. As a result, when oxygenated blood circulates through the body, your skin appears as pink or of reddish tone. Now, if we will talk about the counterpart, that when not enough oxygen is circulating in the blood tends to appear more darker or more bluish purple in color. As you can see in your veins, they appear as bluish green in color. So this shows that when not enough oxygen reaches the tissue, it will tend to change its color to bluish green or bluish purple tone. Now, what does cyanosis signify? Cyanosis basically means that your organ, muscles or tissues are not getting enough amount of oxygen that is required to function properly. And the conditions that can cause cyanosis may be related to your lungs, heart or central nervous system. It's generally divided into 4 different classes. Number 1 is central cyanosis, then is peripheral cyanosis, next is cyanosis due to abnormal pigments, and last one is mixed cyanosis. First is central cyanosis. Central cyanosis is when other parts of the body, in addition to hands and feet or extremities, are affected. This may include chest, cheek, tongue, gum, lips. Now, serious heart conditions or lung conditions can cause central cyanosis. It is basically because of the poor oxygenation of blood in lungs due to interference of exchange of gases. Basically, when in conditions like pulmonary edema or respiratory failure, there is accumulation of serum or fluid in the lungs, which will hinder the exchange of gases, that is oxygen and carbon dioxide, further decreasing the oxygenated hemoglobin levels in the body and causing cyanosis. Central cyanosis is also visible in some of the congenital heart diseases where the deoxygenated blood from the right side mixes with the oxygenated blood on the left side. It is seen in diseases like Eisenmenger syndrome, which is also known as tetralogy of Fallot. Now, individuals in these conditions often have septal defect or hole in their heart. Usually, ventricular septal defect is more common, which causes mixing of blood on both the sides, that is left and right ventricle, which will decrease the oxygen saturation of blood. Now, due to decreased oxygen saturation, the demand of the tissues will not be fulfilled and will lead to symptoms of cyanosis. Also, in the cases of pulmonary and mitral stenosis, cyanosis is also present. Now, stenosis as a word, it basically means narrowing of a pathway or a blood vessel. Now, when the narrowing of the blood vessel of the pathway of pulmonary arteries or cardiac arteries occurs, it will lead to decreased oxygenated blood perfusion and further causing cyanosis. Central cyanosis is visible under the surface of tongue, mucous membrane of oral cavity and the palate. Next, we are going to talk about peripheral cyanosis, which will include perioral cyanosis as well. Now, peripheral cyanosis, as the word indicates, periphery. It will include your hands, fingers and your extremities of the body. It occurs because of the removal of oxygen from the blood when the circulation is slow. Due to any reason, it can be congestive cardiac failure or shock causing vasoconstriction. Now, peripheral cyanosis can also occur in healthy individuals where the extremities are very cold. It is visible in lip, nail, tip of the nose and lobule of the ear. Now, we talked about perioral cyanosis. Perioral cyanosis or circumoral cyanosis is when only your mouth or lips turn blue. It often occurs when your blood vessels respond to the cold temperatures and shrink to conserve the body heat, and it is often seen in newborns, children. In older children, it may appear when they go outside in the cold weather. Next, we are going to talk about cyanosis due to abnormal pigments. Normal hemoglobin has iron in the ferrous form in the body. In methemoglobinemia, iron is changed into ferric form, designated as methemoglobin. Basically, it means that iron in ferric form is known as methemoglobin. Now, severe substances such as nitrite ingestion, sulfonamide ingestion, aniline dyes ingestion This will oxidize the normal hemoglobin into methemoglobin. But in normal conditions, it is reduced back to hemoglobin by methemoglobin reductase 1 or diaphorase 1. If these enzymes, methemoglobin reductase 1 or diaphorase 1, are deficient in the body of the individual, methemoglobin will circulate in the blood. Now, methemoglobin has decreased tendency to carry oxygen, which will further decrease the oxygen saturation in blood and causing cyanosis. Next is sulfhemoglobin. Sulfhemoglobin is abnormal sulfur-containing substance, which is not normally present in the body, but is formed by the toxic action of certain drugs and chemicals like sulfonamides, phenacetin, and acetanilide. Now, sulfhemoglobin, it is an irreversible product. Once hemoglobin changes into sulfhemoglobin, it will never change back into hemoglobin again. And thus it will reduce the oxygen carrying capacity of hemoglobin multiple folds, and because of the decreased oxygen perfusion in the blood, it will cause cyanosis in the body. Next is mixed cyanosis. Due to combinations of any of the factors mentioned above, it can be categorized into mixed cyanosis. Example in cor pulmonale due to pulmonary emphysema. Now we are going to talk about the symptoms and causes of cyanosis. The main symptoms of cyanosis is bluish discoloration of your skin. The bluish tone may also affect your lips, tongue, gums, ears, and nails. If you have darker skin, cyanosis will appear more as grey or white. It may show up more around your lips, tongue, gum, nails, and eyes. Now, mostly cyanosis is caused by another underlying condition in the body, and depending upon what's the cause of cyanosis, other symptoms which a patient can experience include low body temperature, hypothermia, numbness or tingling of your arms, coughing, wheezing, difficulty in breathing, dizziness, extreme tiredness, fatigue, chest pain, frequent headaches, confusion, fever, excessive sweating, which will be due to combination of multiple factors or causes behind cyanosis. Now, as we know that many conditions can cause your blood to lack oxygen levels it needs, which can cause cyanosis. So let's enumerate them. First is pulmonary causes or airway problems, which include choking or suffocation. It's easy. If the person is choked, it will decrease the air supply to the lungs, further causing decreased oxygen saturation levels and causing cyanosis. Next is high altitudes. At high altitudes, there is decrease in the partial pressure of oxygen. So due to decreased oxygen levels, cyanosis can occur. Next is asthma. Next is infection in your respiratory tract or any blood clot in an artery of your lung, which is pulmonary embolism. In COPD patients, cyanosis is very common, in pulmonary hypertension and in lobar pneumonia. These are the pulmonary causes that can lead to cyanosis. Next, we are going to talk about cardiovascular causes causing cyanosis. First is cyanotic heart disease or congenital heart defects, which include tetralogy of Fallot or Eisenmenger syndrome or congestive heart failure or cardiac arrest. Also, arteriovenous fistula, if present, it will lead to decreased oxygen saturation levels in the blood, causing cyanosis. Another cause of central cyanosis include abnormal hepatopulmonary syndrome. That is when toxins are not properly eliminated from the blood which is supplied to the pulmonary system. Next is peripheral cyanosis and its causes. First is congestive heart failure. If the heart is not able to pump the blood, how will the peripheries take the oxygen that is needed to survive, which will cause cyanosis of the peripheries. Next is due to arterial obstruction. If the arteries are obstructed, the oxygenated blood will not be able to reach the tissues properly, which will cause cyanosis of the tissues. And due to venous obstruction, if the blood in the veins is obstructed due to narrowing or any other cause, the blood supply to the heart from the body will be decreased, which will decrease the cardiac output and further can cause cyanosis. Next, we will talk about cyanosis due to abnormal pigments. As we talked earlier, methemoglobin formation due to ingestion of sulfonamide and aniline dyes, and second is sulfhemoglobin formation due to sulfonamide and phenacetin. Now last, the causes of mixed cyanosis include acute left ventricular failure and mitral stenosis. Stenosis is a condition where the narrowing of the passage of an artery or any vessel in the body occurs. Also, another general cause of cyanosis include wearing tight clothes that can limit your circulation. Now a word about diagnosis. In order to determine the cause of the cyanosis, following tests can be done. For example, pulse oximetry, arterial blood gas analysis, chest X-ray, CT scan or computed tomography, CBC, complete blood count, electrocardiogram for measuring electrical activity of the heart, echocardiogram, that is an ultrasound of the heart which shows its function and structure, and it will show any blockade in the heart, Next is pulmonary function test and cardiac catheterization. Now, after determining the cause, cyanosis can only be treated by obliterating the cause. For example, in tetralogy of Fallot or in Eisenmenger syndrome, where the person is born with congenital hole in their ventricular septum, surgery is soon needed after birth. If the person is suffering from COPD or asthma, inhalers or bronchodilators should be given. If the person is suffering from severe lobar pneumonia, antibiotics should be given to treat the pneumonia. Only then cyanosis can be treated. And in general, if the person is experiencing cyanosis due to the cold weather, warmth and massage must be given to the patient. Now a word about pseudocyanosis. Pseudocyanosis is used to describe bluish skin that is not caused by the factors mentioned above in the cyanosis. Pseudocyanosis may be due to the side effect of medications such as amiodarone, that is Nextron and Passeron, which is used to treat atrial fibrillation, antimalarial drugs such as chloroquine and hydroxychloroquine, and tetracycline group of antibiotics.